in the traditional practice, we just felt there was this constant element of guilt on our part because we knew we were not giving the type of care that our patients deserved.
Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hello again. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab Practice Solutions. Man, this is take number 3 for me this morning here. I think the first time I was trying to record this intro, some spring came loose on my microphone stand, and it was like, boing, almost shot my eye out. Then thought I got it squared away, and then I hit record again, and the whole microphone boom just kind of fell down. So we're here now. Everything's in place. I don't think it's going to fall apart, so we're just going to roll with it. All right. So this week, I am going to continue the conversation we've been having on direct primary care. Last episode, we had Chris from Freedom HealthWorks on to talk kind of high level about what DPC is, how those direct primary care practices are managed, what's different between DPC and concierge, and maybe, I think it was like episode 3 of this podcast. So go way, way back in the archives when there was really, really bad sound and audio. I think in that episode, like the extractor fan from our or the transfer fan from our ductless unit was running, and you could hear in the background like psh. Anyways, in episode 3, I sat down with Dr. Rob Lamberts, who's one of the first doctors in my local area. So I live in the Augusta area, home of the Masters golf tournament, if you're into that kind of thing. And he was the first DPC doctor in our area. I want to say one of the first in the state of Georgia, and he came on and talked very high level about his transition, what made him choose direct primary care as a practice model instead of the traditional fee-for-service or insurance-based model. And that was, 2.5 years ago. So we decided to kind of circle back. Some things have changed, obviously, but then just kind of dive a little more in depth. So last episode, if you haven't listened to it, go listen to it with Chris Habig from Freedom HealthWorks. And we talked very high level about DPC, how it's different than traditional primary care, what are the benefits, how those practices are managed, how they make money, all of that kind of stuff. This week, we're taking it a step further and exploring another avenue of direct primary care, specifically the avenue of applying or deploying direct primary care in the business world, specifically for small businesses. It is no secret, especially if you run a business, you own a business, or you're in some kind of management position at a health system or a healthcare organization, you see how expensive benefits are, right? And if you are a small business, you don't have thousands of employees to barter with or to bargain or negotiate rates with payers. It can be outlandishly expensive. The majority of overhead expenses for many companies is payroll expenses, including healthcare and benefits. So this week, I'm sitting down with a buddy of mine who is also in the Augusta area. He's a direct primary care professional himself, Davis Melick, who he shares a little bit about his journey into direct primary care. He and his wife started a practice, and then they merged with another practice, and now they've got 3 locations or 2 locations and one more coming, with a focus on applying this model or using this model of direct primary care to help businesses offer healthcare services to their employees at a way that is affordable, that results in better healthcare overall, not just checking the box of we give you health insurance, but really a method or a tool or a model that's going to help their employees live a healthier life, which hopefully down the line translates to decreased time off of work, decreased work injuries, all of that kind of all that kind of stuff that employers really care about. So hopefully you enjoy this conversation. Again, this show is all about innovation in healthcare, allowing the human element or the relationship between provider and clinician to be formed and strong, and leverage that relationship to help patients live healthier, better, more active lives. So hopefully this conversation points you in the right direction, gives you some kind of maybe thoughts about your own practice or your own model, or if you're in the healthcare tech space, or on how you can support companies that are, really innovating in the way healthcare services are bought and sold. So without further ado, here's Davis Mellick from Welcome Health talking about direct primary care and its specific application in the business world. Well, hey, Davis, welcome to the show. How are you?
I'm doing good, Rafi. How are you doing today?
Doing all right. Can't complain. I'm excited about talking about direct primary care, the business applications, the personal applications. But before we do that, just give us a little breakdown of who you are, what you do, and what kind of brought you to direct primary care.
Yeah, I'm Davis Mellick. I'm a PA with an initial background in emergency medicine. That really didn't speak to a good quality of life for me. And so after experiencing burnout and wanting to be able to spend more time with family, I transitioned to urgent care, primary care. And that did not give me the satisfaction that I was hoping for. And so me and Ed Boland were actually working together, and we were both lamenting about the uh, our negative job satisfaction, as it were, where medicine has really kind of become this moving meat type of thing, uh, and was hyper focused on efficiency and seeing more numbers of patients because that drives up revenue for the business. Uh, I'd come across a New York Times article about direct primary care, and we started talking about it, and it kind of spitballed from there. And we ended up meeting up with Rob Lamberts, who locally was the original DPC here in Augusta. Um, and he had made the transition for a lot of the same reasons that we were looking at something different. We have a love for medicine, a love for taking care of patients, but the burnout is not from patient care, it's from the system.
Yeah.
And so there's this, in the traditional practice, we just felt there was this constant element of guilt on our part because we knew we were not giving the type of care that our patients deserved. And so we decided back in early 2018 that this was something we were going to pursue. And so started kind of doing the elements of it. And then we opened up separate practices. Originally, my practice was Evans Direct Primary Care. And we both opened in January 2019. And after 3 years, we have, 3 successful direct primary care practices. And we really kind of recognized we had this passion for DPC that had grown. And the 3 of us, me, Rob Lambert, Ed Boland, decided to tie the knot per se. And so we merged and became Welcome Health with the idea of we always want our patients to feel welcome, that they're not an annoyance or a hindrance, and to kind of welcome them into a better healthcare home where there's an actual relationship. And that also gave us the ability to kind of add on providers and start looking at expansion and pursue more business applications as well, which can be a great way for businesses not only provide an added benefit that employees greatly appreciate, but can also lower their overall healthcare costs as well and save a business money.
Yeah. All right. Covered a lot there. We'll talk specifically like what is direct primary care, how does it work, and then we'll kind of bridge into the business application. So for somebody who might not know, maybe they've heard of like concierge medicine or, out of network stuff, what is direct primary care?
So quick differentiation between direct primary care and concierge.
Yeah.
Um, Direct primary care, our patients pay us on a subscription basis, on a monthly subscription basis. And we try to make our fees fairly reasonable and fairly low cost to help improve access.
Yeah.
Concierge tends to kind of, it's a little the snootier, the nose up in the air. Um, Tends to be about triple to four times or even higher the price that we charge for the monthly subscription. You're paying for access, and they still are going to bill your insurance. And so, to a degree, it's a little bit like double dipping. There are some great concierge guys out there, though, that do a tremendous service, but it's not necessarily accessible to everybody. And so, one of the main drives with direct primary care is we recognize that our healthcare system is a broken system, just plain and simple. And there are so many elements to our system that dissuade patients from coming in and getting adequate care. And there's so many elements to the system that dissuade providers from even going into primary care or family medicine. We have a massive shortage of primary care providers here in the nation, and it's only getting worse. And one of the main reasons is that insurance, plain and simple, does not reimburse primary care very well. So it has turned into a volume-based uh, specialty, where you end up referring everybody out to a specialist, and that's one of the things that drives up healthcare costs. And
Yeah.
so direct primary care I'm not going to pretend like it's the fix to the system, but it's one of the things that those of us that are actually providing the care can take back some element of control away from insurance companies, away from the screwed up system to provide better access and care. So for our patients, there's no copay. If they need to be seen 5 times in a month, it costs them the exact same. All of our patients are able to access us through a direct messaging app. We use a program called Spruce. So we're able to have this element of continuous communication, which changes our approach in a lot of ways to medicine as well. So you're not getting the staccato of care that you get through a traditional practice where you get seen, you have a brief visit, bunch of beds thrown at you, and then they'll see you again in 6 months, and there's no follow-up to see if we're tolerating the medication well. There's no follow-up to see if they're even working for you. Whereas for us, we can actually have that continuous conversation with our patients to really fine-tune and really help ultimately get control of whatever the condition is. And so it gives power back to our patients. It gives power back to us as providers. And then not only does it allow for better care, the other aspect is we can have complete price transparency. There's this veil of cost within healthcare.
Yeah.
Where
No one
no
knows
one
what they're going to
knows
pay until 6
yeah,
months
no one
later.
knows what the true cost is, and it's intentionally there uh, because it's one of the things that can help. It drives up revenue, and who's it drive up most the revenue for? Well, ultimately, it justifies driving up revenue for insurance companies, and so we as medical providers aren't getting that as
Yeah.
all those crazy increases in healthcare costs. It's not getting trickled down to us by any means. Um, but we can actually tell our patients, hey, I want to start you on this medication. I can send it to the pharmacy for you with your insurance because they use a prescription benefit manager. This may be what your cost is. Ultimately, we don't know because they have a behind the scenes negotiation with the drug company, with the pharmacy. But if you get the medication from us, because we keep an on site pharmacy, I'll tell you, a lot of our medications, they're 3 to 5 cents per pill.
Yeah.
And so we do a very simple 10% markup to cover credit card fees. and for the time that it takes to kind of put the stuff together, but that's it. So we ultimately we're buying it at wholesale, selling it at wholesale. Same with lab work. The it's kind of wild at times. There's always that hesitancy to get your blood work drawn sometimes because you never know what cost is going to end up coming down to you.
Exactly. Yeah. Or that
Um,
that particular, test wasn't covered by insurance, so now you're paying $200 for it or something.
yeah. So, and it's a guessing game on our end when we're billing it to insurance, what code they may actually approve. And it's kept like that once again, intentionally. Um, Whereas for us, we can tell our patients exactly what the cost of a lab is. And so it's kind of wild to think, but one of the things that, just give you a quick list: CBC, which is your hemoglobin, red blood cells, white blood cells, platelets; a CMP, which is a comprehensive metabolic panel, it's a kidney function, liver function, electrolytes; um, a TSH, which is a thyroid screen; A1C, which is your diabetes screen; and a cholesterol panel. When that gets billed out to insurance, typically the charge that comes down is around $400 total for those 5 tests. Insurance may cover it. They may say, oh, we're going to be generous, we'll cover half. But if we do it through our program, it costs $23. And
Yeah.
so it takes away a lot of the guesswork, and it gets rid of a lot of the surprise billing, which, even though there have been some legislation trying to remove that, the behemoth that is our healthcare system, with how bloated it is and with how confusing it has been made, it, plain and simple, it hasn't worked.
Yeah. Yeah, and some of that, I mean, we keep alluding to it, like insurance companies and the convoluted costs. I mean, a lot of it, and the main thing is like malaligned incentives, right? Like you mentioned it at the beginning, healthcare is very much, because we're fee for service, like high volume is the name of the game. So as many patients as we can cram into a clinic in as little bit of a time and maximize the billing, and it's the incentives from a provider standpoint even are not not conducive to that one-on-one quality time that you get with just a direct a primary care physician or a clinician that doesn't have that pressure of like a time-based reimbursement code or something associated with it.
Yeah, well, and with the current system, how it is, you get paid more the more you prescribe, the more
Yeah.
tests you ordered, and the sicker or more diagnoses your patient has. I have worked in facilities where they told us it doesn't matter what it is, you need to send every patient out with either a prescription or a test. And the reason is it leads to upcoding. You can end up billing more as a result.
Yeah.
And that leads to just really poor prescribing patterns. And the other aspect is the system profits on the fact that you're sicker. And so if we in primary care, our main goal is prevention, I should ultimately be helping guide you and teach you both dietary lifestyle changes and things like that, where ultimately I have less prescriptions to have to give you.
Yeah.
That's my long-term goal. That's my favorite thing to do is, hey, we've hit this milestone. We can cut out these 2 diabetes meds now. Hey, you've been doing such a good job. Let's cut out this blood pressure med. And that's really what good healthcare should look like. But it's such a foreign concept within American healthcare that when I first started doing this, I actually struggled on figuring out, well, what, I've never had to discontinue meds before.
How do we do that?
Exactly. Um, which one do I cut out first? Do I do a dosing adjustment? And it was actually a learning curve for me that I did not expect to have to do. But man, is it so satisfying, because a lot of diseases, I mean, plain and simple, we treat them and there's value in treating them. But if we can actually cure the disease with, lifestyle adjustments, heck yeah.
Yeah.
So, I
It's a
mean,
win for everybody.
And so that's one of the things that we do a good bit of is we do a lot of like lifestyle conversations. Um, and so, it's not something that you get or you're even capable of doing in a insurance-based practice, not only because it's time consuming, and that's probably what I spend more time on talking about than anything else. Um, but it's also, I mean, okay, you had a conversation about dietary stuff and you can get a little bit of an upcode for it,
Yeah,
but it really doesn't reimburse much.
exactly. Like what can we bill that for that conversation for?
Exactly. Um, and so I think that's one of some of the big differences there. So for our like individuals and families, the main benefit is that they're going to get really good preventative focused primary care. And we really do try to build a relationship with our patients.
Yeah. Well, and we had somebody on the show a while back who a lot of their work is in subscription pricing, and they were talking a little bit about the application to healthcare. And they basically said like subscription or membership based healthcare services really like just transforms the relationship of the clinician and the provider, or the clinician and the patient, because it's less of a relationship between the clinician working with the insurance company or billing the insurance company to now like the actual the care relationship is now in the center,
Yeah.
because right now you're incentivized to, this person is paying me a monthly fee, like they need to feel that it's valuable, and I need to do my part to make sure that we're helping them achieve their health goals, or whatever it is, and not so much checking the right boxes or billing the right codes in order to get
Yeah.
those upcharges.
Yeah, well, that's actually a really good point. With insurance companies, you have to sign a contract. They can kind of bully you if like you don't agree to things, then they're going to be like, okay, well, we're not going to have you be in network. So you all of a sudden have this large population that they will not allow patients to come see you, and they're the ones writing you the check. They're telling you the rules. They're making you jump through the hoops. So in the end, you are employed as a medical provider by the insurance company in every essence of it. And so insurance companies are the boss in that case. In this case, my each individual patient, they're the boss. Um, they're the ones kind of employing me here, basically.
Yeah.
And so it changes that motivation. And it's like, well, if our goal is patient-centered care, which I think that's a phrase a lot of people have heard, a lot of people have said is patient-centered care, but it's not going to be that, unfortunately, for the majority of patients in the insurance model, because it's insurance-centered care ultimately.
Yeah. Yes. I mean, we'd probably spend another hour talking about that. Let's talk about it specifically for businesses, because what's obviously there's a different payer involved if it's a business,
Mhm.
not a not the family themselves or the members themselves reaching out to you and doing that. But how does it work for businesses? What are the benefits? Because I'm sure there's cost savings benefits from like a preventative standpoint, and disease management standpoint even, I guess.
Yeah. So it's kind of multifactorial. So one, a business can actually provide the membership where they pay for it as a benefit to their employees. Um, they can get a little bit of a tax write-off. I think it's for IRS form 5500, if I remember offhand. I'm not a tax guy, so talk to your accountant about it.
Yeah.
Uh, it is something though that our the employees in general feel is a very good benefit. They actually in polls that they've looked at different benefit options, whether it be insurance, 401k, disability insurance, access to direct primary care is routinely been rated as one of the higher satisfaction benefits that's given. Because what you're giving your employees is you're giving them accessibility. And so the employee doesn't have to pay that monthly subscription. The business is paying it. And so you're saying, like, hey, here is on a silver platter, here is access that's free for you. they're not telling you have to go and change who your primary care is. But if you're kind of given the option of, well, I can go here and I have to pay this copay, or I have to pay X amount out of pocket, or I can come here and it's free.
Yeah.
Free for the employee. That's one of the things that you'll end up seeing really good satisfaction from a benefit standpoint. We have a large number of small businesses, and so for a lot of small businesses, being able to offer things like health insurance is not really an option for them because of the cost. And that can, in today's job market, that can make retention of employees sometimes a little more of a challenge. um, I've had these conversations with business owners. They say patients will, or employees will leave for a job that offers health insurance and take a pay cut and cut their pay in half just because we have so much emphasis and value as a society put on health insurance.
Yeah,
And so,
it's crazy.
sure, I mean, it's one of the number one causes, healthcare debt is one of the number one causes of bankruptcy filing. It's, once again, it's part of a broken system here. Now, and for larger businesses that are offering health insurance to their employees, not only are you getting your employees access, and access means potentially less sick days, less injuries. It means there's no delay in treatment. It means getting them back to work quicker. But the other aspect is if they modify the type of health insurance that they have. And so there's a great health insurance guy, Tom Massney, here locally, who's really kind of using this model a whole lot more. It's been used out west for a while. It's been used up north for a while, but the South, we're always a little slower to adopt some of these
Slow
things.
to adopt, yeah.
And so for these larger businesses, really trying to kind of get control back into the hands of the business on what their healthcare expenditures look like, and switching to what they call either self-funded plans or level-funded plans, where the business has kind of complete control over what sort of things are covered, what the cost is going to be to the employee, and then pairing it with direct primary care. And so there is sometimes a little upfront cost, a little upfront risk on the business, but it gets pretty well mitigated with how these things are written. And so there's a reason these have been used across the nation already for quite some time. Once again, we're just sometimes slower to adopt things in the South. I don't know why, culturally why that is, but that does seem to kind of be the trend. And so when you pair these sort of insurance plans with direct primary care, ultimately what you're doing is you're decreasing that insurance utilization. So there's less claims being made. So we already know with direct primary care, there's about 60% less referrals because we have the time to actually manage these things. And so that drops your claim rate down. There's actually pretty well documented, there's less actual surgeries that end up being required. The vast majority of those tend to be sports medicine surgeries. Kind of right up your alley there.
My alley, yeah.
And the reason is patients are able to come in, they have better access, we're able to treat them, and we're able to get them in with physical therapy or occupational therapy and prevent progression to the point that they even need surgery. So that major decrease in costs there as well. There's less urgent care visits. There's less ER visits because you're giving patients this accessibility. And
I was going to say, if they knew that they can't get in with you for a week or so, then they're like, okay, I'm just going to go down to my urgent care and get this taken care of.
Exactly. Or, hey, it's midnight and I know I'm not going to be able to get anything else taken care of. I'm going to just go to the ER or whatever. And some of it is just, we as healthcare providers are so sometimes entrenched in medicine that we don't recognize the fact that, when someone gets a little cut, they may not know where they can go or what is appropriate.
Yeah.
I mean, the cost of an ER visit is, 10 times, if not higher than that, probably 20 times higher than that, just walking through the door of an ER than going to an urgent care. And if we can help mitigate some of that by, hey, that doesn't need XYZ, this is the best place to go. You can even just still direct care. So maybe a patient does need to go to an urgent care. Maybe it's something I can't handle, on a weekend or something like that. We can actually direct them towards the better cost savings approach as well. And that can ultimately help lower your claims. The
Yeah.
beauty of your level funded and self funded plans is that at the end of the year, whatever you haven't utilized or whatever money that's been kind of put into it, you actually get back as a business owner as a rebate. And so you can then put that money back, reinvest it back into the business. And so,
Awesome. Yeah.
if you're just doing you know, if you're going through and you're just kind of getting a blanket, Cigna plan, which isn't great around here locally, or United Healthcare, Blue Cross Blue Shield, Anthem, whatever, you're paying these premiums, you're paying a portion of it for your employees. They're paying a large portion of it as well.
But that money just goes into the ether. You never see it
Correct.
again.
Yeah, they're just seeing it as part of their multi-billion dollar profits as a result. And so with this, it actually allows for the employer to really take back a lot of control in that expenditure, but then they're also still really doing a great job of providing coverage for their employees. And so with those type of plans, I mean, they can still see specialists. A lot of times copays aren't adjusted. So it's still, kind of their standard copays. Medications are still going to be covered, but it's recognizing the need and the value of having a primary care acting as quarterback. And so we're not operating with the understanding of, oh, we're trying to save the business money. I mean, that's not how we practice. Our goal is still very much patient-centered care, but because of that access, they're going to have significantly less claims and they're going to start seeing cost savings. Now, the cost saving may not always be immediate. It may take 1 to 2 years of kind of being involved in it, and then they will start seeing those cost savings come through.
Yeah. Yeah. No, I did not get the whole piece about the self-funded and the money coming back. That's a good bonus right there.
Yeah. Yeah. And so, yeah, and there are some businesses are already doing some like partially what they call partially self-funded or partially level funded. And so whatever cost savings they end up having, they will get a rebate, but the insurance company is keeping half of it, if not more.
More, yeah.
And so in this case, what you're saying is no, like, why have them do that? You can do this and set it up yourself and increase the amount of cost savings for your business. And so that you're getting all of that rebate back as a result. And so it's really trying to kind of put power back in the hands of businesses to really help them see some long-term benefits. Especially considering I mean, a lot of businesses, I mean, a major portion of their overhead is health insurance.
Yeah, it's crazy.
And there's no other country like that. And so that's really one of the big things is trying to kind of change healthcare outcomes. And that's one of the other things. I mean, with DPC, we see better controlled diabetes, better controlled high blood pressure. Just those two things is going to decrease your cardiovascular risk. Your employees are less likely to go and have a heart attack in the middle of the night. The big tragedies which are also, unfortunately, those are the big cost things, the big things that end up generating revenue into the healthcare system. But we really should be focusing on preventing those and doing so aggressively.
Yeah, absolutely. And if you're in a position to do so without having to worry about upcharging or the lost revenue that would happen because being in the physical therapy space, I always tell people, like, listen, our job is like work ourselves out of a job. Like, we want the patient to be at the point where they're taking care of it. We don't want them coming back and in 6 weeks for the same thing. But there are
Yeah,
a lot of places, because of the way that healthcare is run and reimbursed, that it's like a hamster wheel. They're trapped on it. Like, we need to see so many patients. We need to keep them in here. We need to keep the volume high and our charges at a certain level. Um, and sometimes it means that you lose or you forego some of those treatments that might be in reality higher value to the patient,
yeah,
but not so much higher value to the insurance company or to the provider, right?
yeah.
So awesome. Well, we're getting near the top here. If there's anything that you would want a listener to walk away with, either about direct primary care or the application for business, what would it be?
I, I think the big thing is it's a different mindset for primary care. It's a different mindset for our patients, it's a different mindset for us. And the goal ultimately is looking at long-term solutions and building a relationship with our patients. And so, we approach it from a team approach. Every patient of mine, we go through, and I'm going to go through the data as well. I'm a nerd at heart. But a lot of times it's their ultimate decision as well. But we want to kind of figure out what the best approach is going to be for them. Where, some patients that may be a very aggressive approach, some patients that may be a kind of a slow approach, a build up, and that sort of thing. I mean, I have patients that, it took 2.5 years before the lifestyle conversations really started kicking in. I've had patients where day one, it starts kicking in, but being able to have that time, and I think that's the biggest
Yeah.
difference, is we have that time. We've got the luxury of time with our patients. We've got the luxury of being able to have that continuous conversation with them through our messaging app, and really kind of getting to know them and dive into their healthcare issues at their visits because we have time.
Awesome. Cool deal. Well, Davis, where can people find out about you, about Welcome Health, all the places, I guess?
Yeah, so you can find us on Facebook. You can find us on our website. Our website is welcomehealth.net. Um, and so we've got two offices. We've got one off Davis Road. That's our Augusta office. And then we've got my office here in Evans, which is kind of right down the street from the Evans Taco Sushi is one of the
The landmark, right?
one of the landmarks there. And so we're opening up a third location in Waynesboro this summer. Uh,
Nice.
and so we're hoping to continue to expand and continue to grow this because we see the need for it. We want to, people who've kind of given up on primary care because it's let's be honest,
It's
sometimes it's too
terrible,
much
yeah.
trouble. And as Rob kind of came up with, that we're here for the medically homeless in a lot of ways. We want to kind of be able to welcome you home into a healthcare group that is going to do everything we can to take care of you and your needs and really lead to better overall results.
Awesome. Cool deal. Well, Davis, thanks so much for taking the time, man. Have a good one.
Thanks, Rafi. Have a good one, man.
Well, I hope you enjoyed that conversation with Davis Malik talking about direct primary care and the benefits or potential benefits for employers as they try to navigate taking care of their employees and their workforce and giving them access to high quality, good healthcare. Um, it's been a while since I've had health insurance, either employer sponsored or otherwise. A part of it comes with the territory of being self-employed, I guess. But I was talking to somebody the other day, and because of not having employer sponsored health insurance and having to explore some of these areas, back in 2017 when a lot of this was, still kind of new and up and coming, every time I would have this conversation with, even my wife when I first brought it up, of, okay, we're going to try direct primary care. We're going to use something like a health share, something like that to manage, the cost of healthcare and access to healthcare for us and our family. I've got, at the time, only a couple young kids, and now we've got a few more. But it was one of those, we were on the line for healthcare, to cover our healthcare costs and to make sure we had access to healthcare. And now I tell people, I don't know if I would ever go back to insurance. The cost is just it's outrageous these days. We see people in the clinic that I work, in the clinics that I consult with, patients that have, $5, $6, $7, sometimes $10,000 out of pocket expenses or deductibles before insurance begins kicking in and the like, very restrictive networks. It's just crazy. And what that does on the patient side is it prevents patients from accessing healthcare. Maybe that's the underlying thought there, right? On the part of the payers, is by increasing the cost, increasing the skin in the game, so to speak, or the direct cost that patients have to bear, that they're going to access care only when they need to. But in reality, it's so high right now that I feel like most patients are just neglecting care because they can't afford it. On the other side, what it does to providers, as Davis said, it becomes a volume game. No longer is it about the relationship or the time that you can spend with the patient. It's about how much you can bill. And part of that is the fee-for-service model, which I discuss at length in the book, Better Outcomes, A Guide to Humanizing Healthcare. You can pick that up on Amazon if you haven't already. But what that does, the fee-for-service model, is it skews the incentives in healthcare for the provider to try to see patients for as little amount of time as possible and maximize the amount of billable activity done in that time. So what ends up happening, as Davis shared, is you end up feeling like you're herding these cattle through a system, if you would, or a conveyor belt, in order to really, it's a survival mechanism at some level just to keep the lights on, because the reimbursements are going down, down, down. Patients are having to spend more. It's just, it's tough. It's tough to do that. So the ability to kind of unplug from that, as Chris said in the last episode, and move into a relationship with a healthcare provider or clinician where the relationship really is the center. In one of the episodes that we've done in the past with Ron Baker and Ed Kless talking about innovation in healthcare, we discussed the idea of subscription and value-based care. And Ron and Ed have made the point on their show multiple times that that subscription-based services is value pricing 2.0, because what it does, it truly places the relationship between the provider and the client or the recipient or the member in the center. Because if the relationship doesn't seem to be valuable or isn't proving to be valuable to the member, they just up and leave. So anyways, those are some thoughts on that as we wrap up. Alrighty, over the next several episodes, we're going to be talking with folks involved in healthcare technology, either folks consulting in the space, helping providers implement maybe remote therapeutic monitoring or the like in their practices, or folks that are involved in bringing some kind of cool, innovative tool and technology to the market. So stay tuned for that. And if you happen to have developed a tool technology device and you're looking specifically at bringing that to market here in the US, in the musculoskeletal and rehab space, and you're looking for someone to help you craft your go-to-market strategy or market penetration roadmap, I would encourage you to check out the Market Penetration Roadmap offered by Rehab U Practice Solutions. You can find that at strategy.rehab.practicesolutions.com. That's strategy, rehab.practicesolutions.com. If you like the show, head on over to iTunes, leave us a rating and review. Helps people find us. If you want to be notified when we do release new episodes, you can go to www.betteroutcomes.show. Sign up there. You can also catch all of the previous episodes and listen at your convenience. All right, folks, until the next time, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabuppracticesolutions.com. We'll catch you on the next episode.